Despite all the confusion over booster shots in the U.S., at least one guy managed to snag one today. That'd be Joe Biden, who got his third dose of Pfizer in front of cameras this afternoon. The president qualifies under both the FDA and CDC guidelines since he's over 65, but the back and forth for the rest of us has been truly head-spinning, with the Biden administration first saying anyone who got Pfizer or Moderna shots could get a third dose, then individual FDA and CDC panels weighing in with their own rules and guidelines, some of which ended up getting trumped by the larger body, as happened Friday when the CDC decided to add high-risk workers to the Pfizer booster list, in addition to those 65 plus and anyone immunocompromised.
You know, I recognize that confusion.
In a pandemic, we most often take steps with the intention to do the greatest good, even in an uncertain environment. And that is what I'm doing with these recommendations. I want to be clear. We will not boost our way out of this pandemic.
Of course, she's right about that. To that end, Pfizer's CEO is saying the company will submit its data on vaccines for kids aged 5 to 11 in a matter of days, a significant chunk of the unvaccinated population. But then there are many who've long been eligible but are refusing the shots anyway. Among them, thousands of healthcare workers in New York who are apparently willing to lose their jobs rather than get the state-required vaccine, leading to concerns about staff shortages. And here in Massachusetts, the State Troopers Union says dozens of cops are resigning over the state vaccine requirements set to go into effect next month. Massachusetts also extended its public school mask mandate today through at least November 1st. And while many still firmly believe this is all an overreaction, this is the fact. A study out today from Oxford University found the pandemic has cut life expectancy across the globe by the largest amount since World War II. Here in the U.S., women lost 1.65 years on average, and the life expectancy for men fell 2.2 years. That's the most of any of the 29 countries included in the study. On the bright side, we're hearing more and more about antiviral pills being developed to effectively treat COVID. Joining with more on all of this are Dr. Davidson Hammer, an infectious disease physician at Boston Medical Center and professor at BU Schools of Public Health and Medicine, Dr. Asaf Biton, he's the executive director of Aradni Labs affiliated with Brigham and Women's Hospital and the Harvard Chan School of Public Health. Doctor, it's good to see you both. Thanks so much for being here.
Thanks for having us.
Dr. Hammer, if I can start with you, I worry that public disagreements breed confusion, which breed even more mistrust. Do you share that concern?
I agree. I mean, I think the challenge is that there, so the process has been a recommendation by the FDA. The committee for the advisory committee for immunization practices met, reviewed the recommendations. They came out with a slightly more conservative recommendation. And then the sort of CDC director, in collaboration with other government authorities, broadened that mandate back. That was more in line with what the FDA recommended. So I agree the process is confusing. I think the end result is good, but it actually leaves a lot of sort of liberty for interpretation of who should be vaccinated with the boosters. And specifically, it's only for the Pfizer vaccine thus far.
Of course. Dr. Biton, were you satisfied with Dr. Walensky's ultimate take and how they got there?
I was satisfied, like a lot of other doctors and public health practitioners, with the ultimate decision. I think it's a messy process because science, especially in the midst of a pandemic, is a messy endeavor. We have clear evidence that for some groups like those over 65 and those with immunocompromised status or living in residential facilities, that they would benefit from extra boosting and extra immunological protection as their immune system response does wane over time. I think the hard decision was with the other groups that you mentioned, and ultimately as a practicing primary care doctor, I think that though the process was messy, we got to a place that is accurate with where the science is. Some might disagree, but I don't think that should give us any less confidence in the fact that, number one, vaccines work, and number two, for most people in this group that were described, the booster is going to be effective and safe.
You know, there was a guy in the Washington Post, I think a doctor, who suggested, I don't think in jest, that maybe some public relations people should be added to these advisory committees, because I'm serious, because we consumers obviously begin this process from a very different place than people like you. One thing you mentioned, Dr. Hammer, I'm assuming that we're still up in the air about when the Johnson & Johnson and Moderna boosters will be approved. Is that the state of things right now?
That's correct. I mean, my understanding is that Moderna has submitted paperwork and it's being reviewed by the FDA for a timing for a booster of their vaccine. And then Johnson & Johnson Janssen at least released some data showing how effective their second dose was, their booster dose. So I don't know if they've submitted paperwork to the FDA yet, but I think it'll all be a matter of time.
And the mix and match issue, Dr. Baton, is also still up in the air, is it not? If a Moderna or a J&J person in the first round could take a Pfizer in the booster round, is that not so?
It is technically still up in the air, and the CDC guidance as of today is that this recommendation for boosters in those groups are for people who originally received the Pfizer shot. Now, I think that, and most people think that, those people who receive Moderna or J&J will likely be recommended to get a booster in the Moderna case of a Moderna vaccine and in J&J of one of the 2 mRNA vaccines, but that hasn't been decided yet. What I tell people and what I tell my patients is that, you know, this is a case where we're probably going to get the answers and the recommendations like we will for the kids in a few weeks or less. And so at this, you know, right now, hold tight. If you're in a high-risk group that absolutely should get the booster, talk to your doctor about whether you should mix and match. But for the most part, hold on, and we'll probably figure out the booster that's in an aligned way and not in a mixed and matched way.
Dr. Baton, what do you tell your patients about these, I think, very exciting prospect of these antiviral pills? From what I understand, at least what is being suggested is if you're administered the pill shortly after you're diagnosed, it will prevent further symptoms and limit transmission. How hopeful should we be, and how soon might this happen, Dr. Baton?
Well, I think we should be hopeful. I think we also have to follow the science. Look, this is what we do for a number of other viral infections. This is, you know, what we do for influenza with a number of the over-the-counter, with a number of the prescription pills that you can take orally. Now, if the science bears out that this will be effective, then we will have another part of our armamentarium that we need, in addition to vaccines, masking, good ventilation, that will really help to move this pandemic into more of an endemic phase that we can control and start to move beyond.
Dr. Hamer, I believe I've been mispronouncing your name. I'll try to get it right now. My apologies. Thank you for bearing with me. Do you share Dr. Baton's optimism about the prospect of these pills?
You know, I haven't seen sufficient data yet. As he said, you know, we need to follow science, and I think we need to see more evidence of how efficacious these pills are, as well as how safe, in both sort of post-exposure treatment, but as well as maybe early treatment with somebody shortly after diagnosis is made to try and prevent progression. So I think it's a little early to comment in detail on this.
You know, staying with you, Doctor, I have no expertise, needless to say. I just have anxiety in great amounts. But I am a big mandate person, particularly given the time that people have had. As I said in the introduction, state cops are quitting. They're worried about a nursing shortage. In New York, they're contemplating calling in the National Guard, calling in nurses from other jurisdictions. Is that a price that we should be willing to pay if the mandate gets us to the promised land, or at least close?
I mean, this is a tricky situation. I think there's so much misinformation that's been disseminated over the last year about both about the disease and the vaccines. The truth is that we have now immunized hundreds of millions of people worldwide, you know, with the Pfizer vaccine, with the Moderna vaccine, and to a lesser extent, the Johnson & Johnson vaccine. The safety profile is excellent. And I think that the only way we're really going to get to a high level of coverage in certain populations is to have mandates. And we've had mandates in the past for other diseases, and for travel, for yellow fever, for example, and for measles in certain situations like school entry. And those tend to work very well. So, you know, I think it's a necessary tool in the context of pandemic for control. The challenge is trying to educate and communicate. And as you said, we really need, you know, communication specialists to help us to sort of get the message across.
Dr. Baton, do you share that view?
I do. I think that, you know, it's clear that vaccines are our most effective way out of this pandemic. And I think that when we look at vaccine hesitant populations, you know, there is a large proportion of folks who are not so adamant that they wouldn't get the vaccine that a little nudge, a little push, or a big push like a mandate will get them there. I completely agree. These are very safe, very effective vaccines. I think it's important to also recognize that that there are some people that are not going to be convinced. Now, the question is, and we have to bring it up, you know, in the healthcare worker space and other workforces, people readily take other vaccines, you know, with often much less review of the evidence that is strong for those vaccines as well. So we have to really ask ourselves, why do we have different levels of evidence and different anxieties around, you know, similarly safe vaccines? And I'm hoping that this is that next push that gets a lot of hesitant people over the next finishing line to get them vaccinated.
I can answer your question. We have them because we have some homicidal governors in this country, but unfortunately we don't have time to discuss that. Doctor and Doctor, I really appreciate your time, gentlemen. Thank you so much.
Thank you for having us.